My friend, the gentleman from North Carolina, for his leadership, not only of the Republican Study Committee as the new chairman, and I welcome you as the new chairman of the Republican Study Committee, but for your leadership on issues related to the importance of repealing this disastrous law that is making life harder on the American people, and not just repealing it, but replacing it with policy ideas that put power back in the hands of patients, their families, and their doctors, instead of driving up costs, forcing people to lose their health care plans, forcing the government to ration health care. We need a better way. And I'm proud to say that we are supporting not just repealing Obamacare here tonight, but bringing to the American people some constructive, positive ideas that will make life easier for them and improve their lives through better patient-centered health care. You know, Mr. Speaker, Kentucky was once portrayed by President Obama, a red state, as a model of the implementation of Obamacare. Yet every day in Kentucky, and in my district in central and eastern Kentucky, I hear stories from families and small businesses and individuals who have been hurt by this disastrous law. Now, over the next few weeks, as President-elect Trump comes into office and as this Congress revisits the issue of health care reform, I expect we'll hear from our friends on the other side of the aisle arguments like, don't repeal Obamacare. We have 20 million new Americans who have insurance. But that statistic needs to be scrutinized, because the truth of the matter is Obamacare forced people to lose their health care. In many cases, and in Kentucky as an example, many of my constituents lost high-quality private commercial health insurance through their workplace. And they received, millions of Americans received cancellation notices in the mail. Their small employers told them that they were going to have to change their health plans because of this law. And so not only do we see now skyrocketing costs for those who currently have health insurance, but many Americans who our friends on the other side of the aisle say now are insured or covered, these are folks who lost their health insurance before. And what happened? They lost high-quality, job-based health insurance, and so they were forced to these exchanges, and in Kentucky it was called Connect. And in many cases, they went to the cheapest plan available, which happened to be Medicaid. Well, my fellow Americans, access to a waiting line is not access to health care. And unfortunately, Medicaid is oftentimes access to a waiting line, and it's not access to true health care. So President Obama's promise that his health care law would help people has not turned out to be the case. And in terms of costs, remember, this is called the Affordable Care Act, but it's anything but affordable, because even though he promised that premiums would decline by $2,500 a year for the average family, premiums have actually increased for hardworking Americans. Premiums have increased for 11 million people, according to a report by the Centers for Medicare and Medicaid Services. And millions of Americans, as I said before, lost previous coverage or had to change doctors due to this disastrous law. Take, for example, Laura in my congressional district in Kentucky. Laura's a young mother who had a young baby girl, Catherine. And Catherine was diagnosed with a congenital heart defect, ventricular septal defect, at birth, which is basically a hole in the wall of the heart. And they needed high-quality pediatric cardiology to help Catherine. And so they got a specialist up at Boston's Children's Hospital, of course, a long way away from Kentucky, but they wanted the best, of course, for their daughter. And when Obamacare went into effect, unfortunately, they lost their job-based health insurance that allowed them to access these specialists up in Boston for Catherine. And the result was they lost their doctor. And what do you think a young mother and a young father are going to do in that situation? So guess what? They had to find a very expensive policy to cover a Boston surgeon out of network, out of state. And so their costs skyrocketed. This is the kind of thing that was happening to millions of Americans as a result of Obamacare. And look, Obamacare obviously reduced choice and competition. There are now only 3 plans participating in the Obamacare exchange in Kentucky, one of which covers a full 78% of the state's individual marketplace enrollees. And in many states, there's only 1 plan on the exchange. So this has left too many families with no choice but to purchase high-deductible, high-premium coverage. And in Kentucky, insurance plans have been forced to raise premiums by 23% in 2017 alone. There is a better way. And the better way is health care reform that's focused on the patient, not putting bureaucrats in charge, not taking away choices, not driving up costs, not creating narrow networks for people, not forcing people out of their high-quality private health insurance into government-run health care, but instead empowering patients to access more affordable private coverage. And one of the ways we can lower the cost of health care, make it more affordable for people to access high-quality private health insurance, is medical malpractice reform. Frivolous lawsuits, junk lawsuits, have driven up the cost of health care in this country significantly. And one of the fatal flaws of Obamacare is it never addressed this cause of health care inflation. Over the course of their careers, it's estimated that 75% of all physicians will face a malpractice claim. Now, to be sure, some of those cases of medical negligence are legitimate, and of course those plaintiffs should be able to fully recover damages for those cases of genuine actual malpractice. But for these frivolous lawsuits, that's driving up the cost of care. And the fact that Obamacare never even dealt with that issue is a fundamental flaw in the previous efforts to reform our healthcare system. So I'm a proud co-sponsor of the Republican Study Committee's American Healthcare Reform Act. And in the American Healthcare Reform Act is legislation that I introduced with Senator Barrasso in the Senate called the Saving Lives, Saving Costs Act. This doesn't cap damages for cases of actual malpractice, but what it does say is that if there is a frivolous claim, if the liability climate is producing frivolous lawsuits, what we say is this, that if you're a hospital or a doctor or a nurse and you practice in accordance with peer-reviewed, evidence-based clinical practice guidelines, that there should be a higher standard of proof for that plaintiff to get to a jury trial. We want a safe harbor for our outstanding medical professionals who practice in accordance with the latest state-of-the-art guidelines on how to take care of patients. So this does 2 things. Number 1, it raises the standard of care. We're helping people access better, higher quality medicine in this country with this legislation, and we're cutting out frivolous lawsuits, this litigation lottery that's driving up the cost of health care for all Americans. This is the kind of reform that, if enacted, would replace Obamacare with reforms that would actually lower the cost of health care without growing government. And with that, Mr. Chairman, I'll yield back to you, and I applaud the efforts of the Republican Study Committee for offering real solutions that will put patients and doctors in charge again and not Washington, D.C.